Have you or someone you know ever been worried of having type 2 diabetes? In this video, we're going to look at some telltale signs of what to look out for when it comes to diabetes and what to do in terms of managing diabetes and keeping you staying healthy. So stay tuned until the end. High blood sugar can sneak up on you without any obvious symptoms. In fact, most people don't even know they have high blood sugar until they have type 2 diabetes and probably have had it for some time. I'll be sharing with you some telltale signs that are subtle early on that you can discuss with your doctor if you are experiencing any of them. Firstly, let's look at the overall picture of blood sugar and insulin to get an idea of what's happening first. Then we'll get into some signs and symptoms. So when we eat foods that contain carbohydrates, our bodies break it down into glucose so our body can use that for energy. The glucose gets absorbed into our bloodstream, which increases our blood sugar levels. But your body also knows that high amounts of sugar in the blood can be dangerous, so it produces and releases insulin from the pancreas to get into the bloodstream where the sugars are located to take out the excess sugars and rightfully store it in the liver, muscles, and fat cells for energy purposes. It does this to make sure the sugar levels are never too high in the blood and for the sugars to get transported to where they need to be. That's a normal and simplified process of insulin and sugar in the body. But the problem in type 2 diabetes is that your cells become desensitized to insulin, which makes it very difficult for the insulin to do its job to remove the sugars in the bloodstream, which causes increases in blood sugar levels. An analogy I used to explain to my patients is think of diabetes as a highway, the cars on the highway as sugars and the roads on the highway as your bloodstream. So the sugars are traveling through the bloodstream. And the off-ramps or exits as insulin. In this case, you have all these cars, these sugars driving on the highway, your bloodstream, but with very little exits it can take to get to where they need to go. This causes traffic, which think of traffic as increasing blood sugars at a standstill. The more traffic you have, the higher chances of accidents, and the accidents can represent the damages that diabetes can do to the body if it's not properly managed, like affecting the blood vessels, your eyes, your kidneys, your feet, and more. These are all represented as the car accident in this analogy. When you take insulin, for example, with the right diet and exercise, you create more and more exits and off-ramps so that the sugars, the cars, can leave the highway and get to where they need to go with as few accidents as possible, maintaining a good amount of traffic on the highway and making it safe for everyone to drive in. I hope that makes better sense. So now that we have made sense of diabetes, sugar levels, and insulin, let's finally look at some signs and symptoms of early diabetes. The first sign is making more bathroom trips than normal. Because your sugars are so high, not all the sugars that are being reabsorbed into the body get to where they need to go, so some of it spills out in your pee. And water will follow those sugars into your urine, so you'll have to pee more. So increased urination is one sign. The second sign is increased thirst. Because you're peeing more, you'll naturally feel more thirsty. Increasing thirst is another sign. The third sign is blurred vision, which is a loss of sharpness in one or both eyes. This happens when our sugar levels get too high. It causes our lenses in our eyes to swell, making it hard to see, which can lead to diabetic retinopathy, and if not checked at all, it can lead to blindness if completely ignored. That's why if you are diabetic, it's crucial that you see an eye doctor at least once or twice a year and have a diabetes specialist to work with on your own individual case. The fourth thing is what is known as diabetic neuropathy, which is a nervous system disease that causes tingling and numbness feelings, sometimes with pain too in your extremities. The fifth thing is a reduced ability to heal wounds. This comes back to increased blood sugar levels, which leads to blood circulation becoming lowered. When blood circulation decreases, this lowers oxygen and nutrients to get to the wound sites to properly repair the wounded areas. The sixth thing is a recurring fungal thrush infection in the genital or mouth regions, as well as in certain areas of the skin. For a moment, this can be more UTIs or more yeast infections. Other symptoms can be feeling tired all the time, dry mouth, and feeling irritable more often than not. Then there are those who may be at a higher risk for type 2 diabetes. This includes people that are over 45, overweight, physically inactive, smokers, people who have diabetes that run in their family, or people who have high blood pressure or higher cholesterol than others. All these are known as risk factors for developing type 2 diabetes. Diabetes can cause very serious health problems down the road, so take these signs seriously and follow up with your doctor if you notice any of these signs. Hopefully your signs are not diabetes, but it is important to have that checkup because early diagnosis and treatment can prevent many future complications. Your doctor may want to conduct an A1C test, which is a test result that reflects your average blood sugar levels for the past 2 to 3 months. They'll do this to get a good insight of how your body has been managing sugar. It measures what percentage of your hemoglobin, which is a protein in red blood cells that carries oxygen, that percentage is coated with sugar. The higher the levels, the greater the risk of developing diabetes complications. For example, if your A1C level is between 5.7 and 6.5%, your levels have been in the pre-diabetes range. And if your levels are over 6.5%, your levels are known to be in the diabetes range. These numbers will be used to monitor how well your diabetes treatment is working over time. It's also going to be used as a great step in forming your game plan to managing diabetes with your diabetes care team. But hopefully your levels are within normal range and you keep up with a healthy lifestyle and prevent complications down the road. Definitely share this with a friend or a loved one if they need to hear in on this. The video has a lot of useful information, so make sure to give it a like, subscribe, and stay tuned for more helpful health videos just like these. Thanks for sticking all the way to the end of the video too, and as always, see you on the next one.